Salim. I am the coordinator for the Pakistan Mental Health Coalition, and I'll also be moderating today's webinar. With me, I have Alia. She is the Assistant Manager Advocacy for this scheme. And then I would briefly introduce our panelists, and then they can also give introduction of themselves. But first, we have Zainab Abidin. She's a consultant and a trainee therapist. She's associated with Now PDP and CPPD. And then we have Nayab Imtiaz. They are a psychologist and a disability justice advocate. And then we have, and they're also a person with lived experience. And then we have Farah Ehsan, who is the Special Olympics Pakistan's outreach and community engagement coordinator. I would like the panelists to, introduce themselves one by one. Zainab, you can start.
Assalamu alaikum, everyone. Thank you for joining us today, and thank you, Aruba and team, for hosting us. So my name is Zainab, and I consult with Now PDP, which is a disability inclusion initiative, and also with Charter for Compassion Pakistan, which is also a nonprofit organization. On the side, I also am training to be a mental health therapist with CPPD Pakistan. I also have a brother with intellectual disability, so all these different hats combined to kind of have brought me here. Thank you.
Yes. Nayab, would you like to go next?
Yes. So my name is Nayab, and I'm a clinical psychologist. I'm currently working as a campus counselor at Furman Christian College. I have been working as a therapist, like in that capacity, for the past 4-ish years now. I'm also doing my fellowship with One Future Collective. That is like a initiative by the Global South that basically talks about feminist leadership. So I got to learn a lot about disability and intersectionality and like mental health. So I have like very vast experience when it comes to that. I'm also autistic ADHD, so a lot of the things that I'll be talking today will also be from my personal experience. So yeah, and I love cats. So
Okay, thank you. Farah, please, can you introduce yourself?
मेरा नाम फरा एहसन है और मेरा ताल्लुक स्पेशल ओलंपिक्स पाकिस्तान से है और साथ ही साथ मैं एक स्पेशल नीड्स बच्ची की वालदा भी हूँ और काफ़ी साल से स्पेशल नीड्स पेरेंट्स के साथ स्पेशल नीड्स बच्चों के साथ बहुत क्लोजली मुझे काम करने का मौका मिला है और मेरे जो रियल लाइफ एक्सपीरियंसेस हैं वो आज मैं आपके साथ यहाँ शेयर करूँगी.
Yes, perfect. So first of all, thank you to all the panelists कि उन्होंने हमें आज join किया, and also everyone who's attending. Thank you so much. Hope you learned something आज की इस conversation में. As you all know, disability एक बहुत vast topic है, and there's a lot of चीजें जिसके बारे में हम discussion कर सकते हैं. But for this specific webinar, we want to keep it focused कि mental health and disability किस तरीके से connected है, and किस तरीके से एक का दूसरी चीज पे effect होता है. So I think I would like to start जो मेरा पहला question है with Zainab से. as you mentioned कि you worked now PDP के साथ, right? People with disability के साथ आपने काम किया है. तो what do you think कि ऐसे सबसे common किस तरीके की mental health issues हैं या challenges हैं जो you've seen कि people with disability face करते हैं?
So just to give context to all the audience, मैं थोड़ा सा बस ये mention करना चाहती हूँ कि ये जो दोनों हम चीज़ों के बारे में आज बात करें, मेंटल हेल्थ एंड डिसेबिलिटी, इनकी स्केल कितना बड़ा है. सो देयर आर अबाउट 30 million persons with disabilities in Pakistan approximately. There's more than 50 million people in Pakistan facing mental health challenges. If we look at their intersection, let's say about roughly, there's no exact number, but अगर हम एक estimate लें based on certain sources, 40 to 50% people with disabilities would face some mental health challenge. That's 15 million people right there. 15 million is no small number. And this is how big we are talking about in terms of providing support to individuals with disabilities. Now, generally, overall, based on my experience, both as a sibling as well as a professional, in this sphere has been that सबसे बड़ी चीज जो person with disabilities face करते हैं वो stigma, stereotype, एक एहसास कमतरी, एक कमी होना. डिसेबिलिटी का मतलब एक कमी होना. तो वो जो चीज़ है कि सोसाइटी इन इंडिविजुअल्स को ज़्यादा फेस feel करवाती है कि they're disabled, then them themselves
Yeah.
is the biggest
Yeah.
sort of challenge that they face when it comes to this aspect, and it's very unfortunate, and that's why we need constant awareness.
Yeah.
uh, so overarching, this is one, but it's also important to remember that disability is not doesn't define them. It's not something we
Yes.
can label them with. And so, but unfortunately, at their end, because they're facing it day in, day out, even in this day and age, um, they want to or would like to seek support,
Yeah.
but limited awareness. Besides this, there are so many factors, because this is one group which is usually seen as कि ये एक group है और इसके सारे मसले एक जैसे ही होंगे. ऐसा नहीं है. There's so
Yeah.
many factors that also contribute to this. Age, gender, socioeconomic status, um, type of disability, whether disability was acquired or not. Is it physical? Is it visual, hearing, speech, intellectual? Their subcategories, family support, acceptance. ये इतने सारे factors हैं जिनको आप जब जिनके अंदर अगर आप देखना शुरू करें,
Yeah.
they bring in their own set of challenges. So, for example, a female with disability is likely to
Yeah.
face many, many more challenges than perhaps a male. Why? If you add different layers, so for example, the gender, the disability, if it's poverty, and then if you add some mental health aspect to that as well, that's 4 layers. And then we could add so many more, maybe rural, urban, so many more things. So
Yeah.
generally, what I've observed is that because of these barriers that society has created for persons with disabilities, they are more likely to be undergoing like anxiety, depression. In cases where it's accidental, this could be post-traumatic stress disorder as well. Stress बहुत देखा जा सकता है उस
Yeah.
तरीके से as well. So it's a lot of maybe trauma, abuse. Again, वही जो issues neurotypical individuals face करते हैं, but to a greater extent and depth because of the disability label that society has put on them.
Yes. That's an excellent point. Yeah. I think it is a very, I think it's a complex topic, right? Because there's a lot of aspects that come into play. Yeah, definitely. Farah, I have a question with you, kind of उसी से related. You mentioned that you have a daughter with special needs. तो आपको क्या लगता है कि किस तरीके के environment और support उन बच्चों को चाहिए होता है जिनकी special needs है, जिससे वो included and safe feel कर सके? Especially because, as I've noticed in my experience as well, and you mentioned as well, कि isolation is one thing जो स्पेशली बच्चों को जो है काफी ज्यादा फेस करनी पड़ती है. तो व्हाट वुड यू से कि इज द बेस्ट टाइप ऑफ एनवायरनमेंट और किस तरीके का सपोर्ट नेसेसरी होता है इस तरीके के बच्चों के लिए?
अच्छा, सबसे पहले अगर हम बात करें पॉजिटिव रीइंफोर्समेंट की, देखिए पॉजिटिव इन्फोर्समेंट जो है वो हर इंसान के लिए बहुत इम्पोर्टेंट होता है. अगर हम
या
न्यूरोटिपिकल और न्यूरोडाइवर्स दोनों तरह के बच्चों की बात करें, कि अगर उनको पॉजिटिव रीइंफोर्समेंट और इमोशनल सपोर्ट दी जाए तो वो बहुत बेहतर तरीके से काम कर सकते हैं. इसमें सबसे
या
ज़्यादा एक तो ज़रूरी है कि इमोशनल सपोर्ट और एक्सेप्टेंस, कि वहाँ बच्चों का जो माहौल है वो जजमेंटल माहौल ना हो.
या
एक इमोशनल सपोर्ट बच्चे को फराहम की जाए और वो उस माहौल में जजमेंटल फील ना करे, वो सेफ महसूस करे, सिक्योर महसूस करे, और जो स्टाफ है, ये जो केयर गिवर है, वो मुकम्मल तौर पर ट्रेन हो. उनके लिए ऐसे सेंसरी फ्रेंडली माहौल हो, जगह हो, जहाँ पर वो अपने आप को बेहतर तरीके से अपनी परफॉर्मेंस कर सके. साथ ही साथ अगर हम बात करें एडेप्टिव इक्विपमेंट्स की, एडेप्टिव इक्विपमेंट्स का मतलब ये है कि हम बात करते हैं कि उन डिवाइसेस की या उन टूल्स की जो ये बच्चे या ये बड़े अपने डेली लाइफ रूटीन में जो उनके लिए हेल्पफुल साबित हो सकती है. जैसे कि अगर हम बात करें कि अगर कोई बच्चा हेयरिंग इम्पेयरमेंट के साथ है तो उसके लिए हेयरिंग इम्पेयर्ड का इंतज़ाम होना चाहिए. उसके लिए अगर वो फिजिकल लिमिटेशंस के साथ है तो उसके लिए ऐसे रैम्प्स बनाए जाएं जहां उसका जाना एक्सेसिबल हो. उसके लिए व्हीलचेयर का इंतज़ाम होना चाहिए, तो जहां वो अपने आप को एक सेफ सिक्योर भी महसूस करे. और जिस माहौल में है वो वहाँ पर, तो वहाँ हम एक चीज़ और डिस्कस करना चाहती हूँ कि प्रिडिक्टेबल रूटीन, बच्चे का प्रिडिक्टेबल रूटीन होना बहुत ज्यादा जरूरी होता है। ये पेरेंट्स और
हम्म,
केयर गिवर और जो भी उसका कोच है उसके लिए ये चीज जानना बहुत जरूरी है कि प्रिडिक्टेबल रूटीन इसलिए जरूरी है कि वहां पर बच्चे को एक्सपेक्टेशंस बड़ी बड़ी क्लियर होती हैं, उसको जो भी हिदायत दी जाती हैं वो बड़ी क्लियर होती हैं, उसमें उसको पता होता है कि ये टाइम
yeah,
मेरा सुबह स्कूल का है, ये मेरा स्कूल टाइम है, या ये मेरा ट्रेनिंग टाइम है, ये मेरा बेड टाइम है, ये मेरा लंच टाइम है। तो उसमें उसकी एक्सपेक्टेशंस बड़ी क्लियर होती हैं। तो ये ऐसा माहौल बच्चे को कंफर्टेबल, सेल्फ कॉन्फिडेंट और वैल्यूड महसूस करवाता है, और वो ज्यादा बेहतर तरीके से पार्टिसिपेट कर सकता है।
yes, excellent points. My next question would be नायाब आपसे कि जैसे कि I think जैनब ने मेंशन किया कि सबसे बड़ा इशू है स्टिग्मा। तो हमारे वैसे भी हमारे इन्वायरमेंट माशरे में काफी स्टिग्मा है, बोथ मेंटल हेल्थ से रिलेटेड भी एंड डिसेबिलिटी से भी रिलेटेड भी। तो एज समवन हु हैज एक्सपीरियंस दोनों चीजों में विद मेंटल हेल्थ एंड डिसेबिलिटी, व्हाट डू यू थिंक कि किस तरीके के चैलेंजेस है, और क्या आपको लगता है कि इट क्रिएट्स अ फर्दर बर्डन ऑन द पर्सन, राइट? तो व्हाट डू यू से अबाउट दैट?
Okay, thank you for asking that. Because yeah, as somebody who has been on like both sides of the desk, when it comes to like being a therapist and then also like
Yeah,
somebody who is in therapy or was in therapy, I think it definitely amplifies the stigma. Like वो stigma को बहुत ज़्यादा amplify कर देता है because with people who do not understand the intersections of disability and mental health and how it shows up, तो वो जो स्टिग्मा है वो सिर्फ बाहर लोग के लोगों के लिए नहीं है, इट समटाइम्स ऑल्सो शो अप इन द थेरेपी रूम, राइट? एंड
yeah,
विद दैट आई वुड लाइक टू मेंशन के एज आई थिंक जैनब ने भी बात की कि नॉट ऑल डिसेबिलिटीज आर सेम, राइट? सो एवरीबडी हैव देयर ओन
yes,
डिफरेंट स्पेसिफिक नीड्स, और सारी जो डिसेबिलिटीज होती हैं वो विजिबल भी नहीं होती, राइट? देयर कुड बी अ डिसेबल्ड पर्सन बट सामने जो देखने वाला है उसको नहीं पता कि वो दिस पर्सन इज डिसेबल्ड.
yeah,
Specifically, if I talk about neurodivergent, neurodiversity, so I am somebody who is apparently very high masking and like high functioning. So I have been in spaces where I was being dismissed, right, in therapy spaces because mera autism sometimes, balki a lot of times when I go into therapy, my autism is what is causing because it is a disability, right? So it is causing the problems that I'm currently facing in my life, and I talk about those
yeah,
things in a therapy setting. So sometimes there's like a lot of dismissiveness. दूसरी चीज is the lack of accessibility, right? If for
yes,
example if there's somebody जो कि wheelchair पे है and there's like the counseling center or whatever it is like on the first floor, तो पहले तो उस चीज को access ही नहीं कर सकते, right?
yeah,
दूसरा, there is no like registry for example for like specific therapist या no resources जो हम बता सकें कि okay if you are like struggling with disability या ये specific लोग हैं जिनको you can reach out, because mental health पहले ही इतनी ज्यादा accessible नहीं है, it's not affordable to even
yeah,
neurotypical people, so that is like an added layer of complication, that is accessibility and like including affordability. There's also like a lack of understanding by the professionals because they don't understand the क्या कहते हैं, the intersectionality of mental health and disability and how
yeah,
disabled people have specific um, different kind of challenges. So yeah, it obviously clubbed together to just added layer of
yeah,
complexity के ठीक है पहले
yeah, yeah.
for example if they're living in an abusive household or they're
Mhm.
in an abusive environment, वो तो ठीक है उसका trauma है, but there's also challenges because of their disability, right? So yeah,
Yeah,
when it is like put together, just creates a lot of
yeah,
additional barriers to it.
yeah, 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 that's true. I think similar to what you just said, Zainab, would you like to talk about, कि सबसे बड़ा barriers आपको क्या लगता है कि people with disability जो है वो mental health अगर उनको services चाहिए तो उसकी access में उनको क्या barriers होते हैं?
I think just building on what Nayab and Farah said in terms of the barriers outlined, again, stigma, stereotype, and that is just where it
Hmm.
actually before that one step is awareness. Mental health की
Yeah.
awareness है भी या नहीं. So just
Hmm.
in now PDP today, if I ask, my colleagues with disabilities, do you know about mental health? How many will be able to, say, yes, I do? Or perhaps if I ask our beneficiary base, कि, mental health के बारे में पता है, जहनी सेहत क्या होती है? तो immediately ये चीज तो नहीं आएगी कि ओ वो डॉक्टर को जो दिखाते हैं, right? Because
Yeah.
that's the general perception. But do people
Mm.
even know and understand what mental health is and what that entails? Is the main question. That's where it starts. And then again, when it's like, okay, we know what this is, हम अब इसको कैसे access करें? तो access करने से पहले भी कि मैं इसको मुझे समझेगा या नहीं, again the stigma, the stereotype,
Yeah.
कि मेरे अंदर एक कमी है, मैं किसी को बताऊं कि कोई समझ सकता है नहीं. Also interestingly, like a lot of community aspect is also seen here, right? Because, for example, individuals who are
Yeah.
hearing impaired, they really like to stay within their community. They share within their community. They even marry within their community, right? So it really
Mm.
says a lot about the kind of trust and the kind of opening up that they want to do. So would they be able, are they comfortable with opening up and trusting someone like that? So for example, for services, people with disabilities at now PDP might trust us a lot, but for mental health, would they trust us? Right?
Yeah.
Even if we're equipped in-house to provide those services. So वो दो बड़े elements हैं, stigma and trust after the awareness of mental health itself. Then of course, as Nayab and Farah mentioned, the infrastructural aspects of it, the accessibility, is there wheelchair
Mm.
access? If we're going on an in-person session, hearing speech may,
Yeah.
is the therapist even equipped with sign language?
Yeah.
Or if there is an interpreter that is needed, is that possible with the consent of the person seeking therapy? With visual, whatever the aspects are required in terms of getting online, how to use technology to be able to get access to a counselor. And of course, then of course with intellectual disability, we're looking at, is this person, will they be able to take therapy themselves? If it's a child, for example, is there a caregiver coming with them? Or if it's someone whose intellectual ability, for example, like my brother, probably needs assistance to go along with someone to seek support
Yeah.
that way. Because what he might be trying to explain, I can understand better.
Yeah.
And perhaps we might get at a point in life in Pakistan where therapists might be able to understand that also and may not need me or any other of his caregivers. So that's there. Zahir si baat hai, resources एक बहुत बड़ा element है, as also identified by Nayab. Um, Therapy is expensive. Also, having a
Yeah.
child with special needs भी बहुत like it is expensive in the sense के special needs के साथ additional care आता है, additional चीजों की जरूरत होती है,
Yeah.
additional detailing के अंदर जाना, वो support ना आना from a healthcare point of view, from every aspect, which is not something that is
Yeah.
bad. It is reasonable accommodations for them, and that's their absolute right. But when it combines together, as you were telling
Mm.
someone with disability who's, for example, living in interior Sindh, कि आप mental health की, support seek करें, उसके तो जहन में भी नहीं आएगा. This is going to be like a far-fetched sort of a need that comes
Yeah.
up that पहले मेरे पास खाना पीना accessibility ये तो हो, फिर उसके बाद job हो, कोई skill हो,
Yeah.
कोई जिंदगी में कोई इस तरह की चीज तो हो कि मैं अपनी परेशानियों के बारे में बात करूं. So that comes
Yeah.
in way later. But obviously, if we institutionalize it, it will come in much more earlier. Then, of course, again, like gender, rural urban divide, पॉलिसी लॉ क्या कहता है, क्या कवर करता है, पर्सन विद डिसेबिलिटीज को मेंटल हेल्थ सपोर्ट प्रोवाइड करते हैं नहीं करते. सो ऑब्वियसली पर्सन विद डिसेबिलिटीज के लिए ऑलरेडी इतने चैलेंजेस हैं पाकिस्तान में. सो एड द लेयर ऑफ मेंटल हेल्थ टू दैट, while it's going to be amazing, and it is very amazing to the people who have seeked support that I've spoken with as well, it's life changing. It's even if it's
Yeah.
not life changing, it's just good. It's very good and very relieving to speak to someone.
Yeah.
You feel heard. But
Yeah.
we're all trying, I guess, and I hope at some point we are
Yeah.
able to, cross as many
That
barriers
is
as.
the, yeah, that's the harsh reality of our society कि हमारे पास इतने avenues नहीं है, इतने resources नहीं है, तो support provide नहीं कर सकते. That is very true. But I think there are, जिस तरीके से, I think I'm going to pivot the conversation थोड़ी सी उस तरफ कि जिस तरीके से there are a few avenues जिससे I think people with disabilities को फायदा हो सकता है. For example, sports is a thing, right? And Special Olympics Pakistan as an organization वो इस चीज पे काम करते हैं. They have a lot of athletes with disabilities के साथ. तो फरा, would you like to talk about it कि किस तरीके से जब ये बच्चे जो हैं स्पोर्ट्स में एंड पब्लिक इवेंट्स में पार्टिसिपेट करते हैं, तो हैव यू सीन कि उनकी मेंटल हेल्थ पे किस तरीके से इफेक्ट होता है एंड किस तरीके से बेटर कोप कर सकते हैं?
अच्छा, मुझे लगता है कि अभी भी एट दिस पॉइंट लोग सीख रहे हैं। अभी भी हमें
या
इस बारे में, मतलब हर कोई चाहता है, मेंटल हेल्थ के बारे में जानना चाहता है। और ये हम रियलाइज करें कि मेंटल हेल्थ होती क्या है। हमें लोगों को बताने की जरूरत है कि भाई, जिस
या
तरह जिस्मानी सेहत इम्पोर्टेंट होती है, इसी तरीके से दिमागी सेहत का भी ख्याल रखना बहुत जरूरी है। जब बच्चा, यानी एक स्पेशल नीड्स के साथ एक बच्चा आपके पास है, तो जिस तरह हमारे पास आप देखते हैं जो स्पेशल नीड्स के बच्चे होते हैं, उनकी जिंदगी में तो वैसे ही बहुत सारे ऐसे चैलेंजेस होते हैं, कि वो उनकी वजह से उनकी मेंटल हेल्थ ज्यादा मुतासर होती है, और वो खुद अपने चैलेंजेस के साथ फाइट कर रहे होते हैं, कोप अप कर रहे होते हैं, वो ज्यादा घबराते हैं,
या
ज्यादा एंजाइटी का शिकार होते हैं, ज्यादा परेशान रहते हैं, ज्यादा उदास रहते हैं। तो इस लिहाज से हम सबको ये सीखने की जरूरत है कि मेंटल हेल्थ जो है वो कितनी जरूरी है, और उसका भी उतना ज्यादा ही ख्याल रखा जाए। उसके लिए भी हमें कुछ इकदाम करना बहुत जरूरी है। अच्छा, इस हवाले से हम क्या कर सकते हैं? हम मेंटल हेल्थ कंडीशंस के बारे में अवेयरनेस और इंफॉर्मेशन दे सकते हैं। हम ऐसा माहौल और उनकी जो इमोशनल वेलबींग है उसको सपोर्ट कर सकते हैं। हम ऐसा
या
ट्रेन और ऐसे वॉलेंटियर्स को मुनासिब सपोर्ट दे सकते हैं जो इन बच्चों के लिए काम करते हैं। हम ऐसे अवेयरनेस और ऐसे एक्सेप्टेंस को फरोग दे सकते हैं, जो हम ऐसे माहौल को पनप सके, जो ऐसा माहौल बन सके जो इन लोगों के लिए ज्यादा इंक्लूसिव हो, ज्यादा सपोर्टिव हो, ताकि वो बेहतर तौर पर आगे बढ़ सके।
यस
और इसमें एक चीज
डेफिनेटली।
मैं और यहाँ पर ऐड करना चाहूंगी कि जहाँ पर बच्चों को इस बात का एहसास दिलाया जाए कि आप अपने पूरे एसेंस के साथ जैसे हैं, जहाँ हैं, हमें कबूल हैं। आप अपनी तमाम कैपेसिटीज के साथ हमें
या
एक्सेप्टेबल है। तो वो चीज जो है इनको एक सपोर्ट फराहम करती है, और वो हर चीज जो है उनकी सेहत के लिए और खासतौर पर मेंटल हेल्थ के लिए बहुत जरूरी है। तभी
या
हमें फिर उनकी फिजिकल हेल्थ में भी बेहतरी नजर आएगी।
yes, definitely. That's an excellent point. I think my next question is for Nayab. जिससे कि साहब ने कहा कि we don't have इतने ज्यादा सर्विस प्रोवाइडर्स जो कि उसकी जिनको इतनी अंडरस्टैंडिंग हो कि किस तरीके से पीपल विद डिसेबिलिटीज हैं, उनके साथ किस तरीके से जो है उनके साथ काम करना है, किस तरीके से थेरेप्यूटिक सेटिंग में करना है. तो as someone who's been, on both sides, what are a few things that you would like to tell fellow therapists या fellow practitioners को to be mindful of? Okay, when you're working with इस तरीके के clients that have special needs या certain disabilities, तो हम किस तरीके से उनके साथ बेहतर जो है थेरेप्यूटिक सेटिंग में काम कर सकें?
Okay, so there's a lot to talk about, limited time, so I'll just touch the basics, right? Because as somebody who has been in therapy, like my specific
Yeah,
barriers, I can talk about them and like how did I navigate
yeah,
it through them, and like then talk
yeah,
about what can like other therapists do, right? So
yeah,
finding the right kind of therapist was extremely difficult for me because as I mentioned earlier, a lot of my problems were very specific to me being autistic. And I think in that journey, I
yeah,
also realized how much the society was kind of failing us. Because if I talk about ableism, right, that is being
mhm,
discriminated based on, a person's disability. And
yeah,
for somebody who is not like, अगर आप देखने में I do not look disabled, right? So I had to face a different kind of ableism as compared to जिनकी disability बहुत visible होती है. और
yeah,
how I experienced it was the continuous dismissal. Because if you go to a therapist and given there's no specific criteria in DSM when it comes to adult autism and ADHD, right? All the research has been done on white boys, right? Jitni bhi autism pe research hui hai, it is like very specific, right? And when you grow older, somebody who has been like, I got my diagnosis when I was like late 20s, right? Or mid 20s.
yeah,
So that was an added layer of complication because I'm like, oh, how do I navigate through this? Like, no, there's no
yeah,
specialist for adult ADHD or autism. It doesn't mean कि वो पहले नहीं था. It's just कि I was very good at masking it because the society was like,
Yeah.
no, oh, you're not disabled. Like you don't look
Yeah.
disabled, right? So you have to
Yeah.
learn how to mask and get over it
Yeah.
technically. दूसरी I think जैनब ने बात की थी community की. um because when it comes to therapy बहुत एक individual white centric concept है, like जो practice करते हैं, right? It talks about
Yeah.
individuality, it talks about आप क्या कर सकते हो to make it better. With disability,
Yeah.
sometimes individual level पे there's like a limit to how much can you do. It's the society that needs to change. दूसरी चीज जो I've been thinking about and I've been thinking about like बहुत अरसे से is the concept of special needs, right? Because in my head, I'm like, oh, am I asking for too much if I'm asking for accommodations? Like, are these special needs or is it just my basic human rights? Right? So even in language, sometimes ableism shows up like as a concept because I'm like, oh, special. It's not something special because
Yeah.
it's basic human decency. Because if I talk
Yeah.
about if somebody is like left-handed, right? हम उनकी needs को
Yeah.
special needs नहीं बोलेंगे, it's just accessibility needs because ठीक है, you're left-handed. It's not seen as a something that is out of the ordinary.
Yeah.
ठीक है, they're struggling and we provide them the accommodations and then they're all good, right? So that's also an added layer of stigma attached to
Yeah.
being neurodivergent and that disability. Um, Another thing that I want to talk about was the emotional labor, right? Because sometimes when we go to a therapist office and the therapist is not aware of how disability works, um, as a counselor, as a therapy, I would take it on me to educate the other person. Because उनको नहीं पता, so I have to put myself in that role कि okay, I'm gonna teach you, and it takes a lot because we have been advocating for ourselves pretty much our entire lives, right?
Yeah.
And it's just it takes out the therapy part out of the therapy because I'm like, oh, I'm just advocating for myself. Like, why do I have to? Agar I have like 60 minutes, I'm paying so much money for it. Then why I have to spend आधा घंटा about educating you? So that brings me कि हम as a therapist क्या कर सकते हैं is to understand, learn about the perspectives from disabled people, not specifically by people जिन्होंने who are not disabled but उन्होंने disability के बारे में पढ़ा है. So people who are disabled will be able to guide you better what they need, what their needs are, how is therapy gonna work for them. So always learn from disabled people
Yeah.
about how they're struggling, what do they need,
Mm.
because a lot of times we
Yeah.
assume things. It is very common in
Definitely.
research as well, right? Like for example, if I talk about gender non-conforming people, it's like all the cis people do the research, अब फिर वो आपको हमें बता देते हैं कि okay, this is what you do. But a lot of times disabled people are not even talked to. Like there are no disabled people on the panel, no disabled people
Mm.
who are, तो वो उनकी तरफ से नहीं आ रही होती चीज, right? So
Yeah.
um, for the fellow therapist or trainee therapist or whoever is listening to us, um, do your research. And it's okay
Yeah.
to ask if you don't know anything, but do not expect that emotional labor and do not put that entire burden on your counselor or your therapy because
Yeah.
it
Mm.
hinders the process because it's just a lot. Because
Definitely. Yeah.
sometimes
Yeah.
I'm like, do
Definitely.
I talk about my issues? Do I talk do I educate this person? What do I do? So sometimes it's
Yeah.
exhausting, but yeah.
Yeah. Yeah, I can understand that definitely. And I think it's you mentioned the term, right? K special needs वगैरह. Even when I was researching for this webinar, uh, especially जब हम उर्दू में उसको translate कर रहे थे, तो there were a few terms that came up that felt थोड़ा सा like even I felt hesitant कि this just doesn't make sense अगर आप ये term use कर रहे हैं कोई terminology इस तरीके से. So as someone, what do you think is the appropriate term to refer the people who would be usually called as people with disability or people with special needs. So yeah.
Okay, so I don't think I have a particular term because I think special needs is like a very like clinical term, like it's
Yeah.
like used in research, but I think it's also um important to understand कि जो हमें models वगैरह पढ़ाए जाते हैं, like kind of like question it a little bit, right?
Yeah,
कि
yeah,
were they ableist, like वो कहाँ से, what's the history? Because if you look into the history of rehabilitation of like disabled people,
yeah,
particularly about neurodivergent people, right? So it
hmm,
has its roots in eugenics, because they were
yeah,
like, oh, these people are disabled, like kill them all. But then there were people who came in and like, no, we can actually rehabilitate them and like use them like so that they're better suited citizens, like वो society के लिए कुछ कर सकते हैं, right? And that also brings me to the point कि how a lot of people with disabilities, they are genuinely disabled and struggling, right? So it also
yeah,
puts us under that कि नहीं आपने mass करना and you have to do something, right? And it reinforces that
yeah,
idea कि okay, I cannot be a non-special autistic person, because with autism it's also like oh, you have to have special interests, or like you're a genius, right? तो वो एक वो वाली चीज भी होती है.
yeah,
So
yeah,
sometimes when I'm looking at them, and there are people who are geniuses, like amazing people, but it also takes away my humanity a little bit, because I'm like, okay, what if I'm not special? Then what?
yeah,
Like, do I not have a right to access mental health? Like, what then? And I think a lot of disabled people do feel that way, because like
yeah,
उन्होंने वो बना दिया ना कि नहीं, you are special, like वो disability बीच में ही रह जाती है, because there's no accessibility, it's never
yeah,
talked about. It's like you have to constantly
yeah,
push yourself, you have to do better, you have to not forget you're not your disability, right? All that
yeah, yeah,
toxic positivity. So sometimes it is also hindering. So
yeah,
sometimes we need that space to be created to just be our disabled
yeah.
self. It's not.
Yeah, I think the best we can do as even like as professionals or people who are working in the field या फिर वो किसी के साथ environment में है, to just be mindful and try to learn, और जितना ज्यादा वो open mindedness के साथ जो है they can interact. I think that's the best way to move forward. I think
Exactly.
I would like to ask Zainab, right? For example, you're working with now PDP. So how do you think is thinking the organizations, for example, now PD, where they do talk about physical disability. So how can they incorporate more mental health support? An organizational level पे, what do you think, is a necessary step जो कि लेना चाहिए?
I just want to first add to what you guys were discussing about the language bit, right? There's been
Yeah,
so much debate that I've been seeing since this past decade because I've been associated with now PDP for a decade now. I've come back again, was working with KDSP on Down syndrome,
yeah,
and even now that it's never ending the debate. It's never ending, and it's actually interesting because like irony bhi hai. Deaf community wants to be called deaf, not persons with hearing speech impairment, right? Some of them, let's say, and they're very proud of this. They own this.
yeah,
इसी तरह, certain there's this thing between impairment, disability, and there's another thing as well to this. So it's again, WHO has a specific point term. कि disability is a more universal term. I think at the end, at least personally, what I conclude, and I think generally some of the people over here at work also believe that what we're doing, एक तो first and foremost just आप लोग कह रहे थे courtesy जो देना, जो respect
yeah,
देना for any human being, be that a person with disability or not. And secondly, what you're doing for them, what you're doing with them, right? Like मिलके हम क्या कर रहे हैं? So what are we doing to provide education, provide jobs, the basic rights, which are not anything special to say the least.
yeah,
Dr. Shaista ने भी एक बड़ा interesting इसमें डाला है कि UAE में they call them people of determination. So that's again, so in some parts of the world, we are like again positive उस पे जा रहे हैं. Some parts of the world, we're still
yeah,
debating. What matters at the end is A, respect and dignity, and B,
yeah,
what we're doing for them. Coming to your question on collaborations, it's actually very interesting because I'm in a space right now, very fortunately, where I'm able to create these bridges and be part of those
yeah,
initiatives. So at one end, I'm working with Now PDP, which is a disability inclusion initiative, a one-stop shop for anyone with a disability. So we provide all the way from information, Shanafti card to like, education, jobs, all the way to empowerment. Then
yeah,
comes Charter for Compassion Pakistan, which is a nonprofit that is working on spreading compassion. And one of the programs that it actually has
mhm,
is on mental health. And then there comes CPPD, which is a counseling school, which I'm training with to be a therapist. Now that's the beauty of this chain. Okay, and as I
Yeah,
see it would work is that organizations like CPPD, training schools like CPPD, could train and collaborate with organizations like Charter for Compassion and so many others
yeah,
in the mental health coalition. And they are already working together to really provide better mental health care, train them to be better mental health counselors, therapists, in the whole ecosystem. Then they
yeah,
collaborate with NGOs like now PDP, Karachi Down Syndrome
mm,
Program, so many others, Deaf Reach ho gaya, to actually, and then they work together to understand disability and mental health ka intersection,
mm,
and then really provide that inclusive mental health care to persons with disabilities. In fact, right now, just very
yeah,
recently, now PDP and Chart of Compassion have started working together to provide mental health care to persons with disabilities in now PDP's network. And of course, the idea is that in future, now PDP could also build capacity in-house to be able to do that unofficially to sub.
yeah,
There's this entire
yeah,
team
yeah,
dedicated to working with community outreach and dealing with the beneficiaries, and they are day in day out so many stories, stories, countless little things, and it just makes so much of a difference to just hear out. Just listening
yeah,
is powerful. It's beautiful, honestly. So
yeah,
अगर सिर्फ हम ये ही कर लें, and also just to give another example of KDSP, at KDSP we have emotional support groups as well as informational support groups. So information about people with Down syndrome and what all Down syndrome की दुनिया में क्या है, ताकि parents और caregivers इनको पता ही नहीं है Down syndrome क्या है, उनको
yeah,
पता Lakin, when it also comes to seeking support for for mental health in terms of emotional support, how do I navigate being a parent to a child with Down syndrome, right? And same applies for disability.
yeah,
They actually have been from day one having these sessions, be it on stress management, be it on anxiety, being on any aspect related to what comes their way with the emotional needs that come with having a child with Down syndrome, be it a parent, be it a caregiver. That
yeah,
has built such a beautiful community. And again, another aspect to that was that some parents who have been associated with the organization for a while, some parents who've
mm,
also been, are really like equipped to help other parents. So they
yeah,
actually call rahis. So they actually support other
yeah,
parents as well.
yeah.
And
That's
it's
an excellent initiative. Yeah, definitely. And I
so
think that
it's
now that we're talking about carers and parents, I think Farah, it would be a great point for you to jump in and share what it's like to be a parent to a kid with special needs or intellectual disability, and किस तरीके से sports or Special Olympics has played a part. So it would be great if we could hear from you.
अच्छा, जिस तरह अभी जैनब ने कहा पेरेंट्स के हवाले से, मेरी स्टोरी भी मोर और लेस इसी तरीके से जैनब स्टार्ट हुई थी बैक इन
Yeah,
2000, जब मेरी अपनी बेटी जो कि मेन स्ट्रीम स्कूल में थी और बहुत ज़्यादा बुलिंग और आइसोलेशन उसने फेस की। जाहिर है उसके साथ कुछ लिमिटेशंस थी, उन लिमिटेशंस का मुझे अंदाज़ा नहीं था। एक असेसमेंट जो कि क्लिनिकल असेसमेंट बच्चों की कराई जाती है, जो ये बच्चे इन चैलेंजेस के साथ होते हैं, और इस प्लेटफॉर्म से मैं ये मैसेज पेरेंट्स को देना चाहूँगी, प्लीज़ अगर आपके बच्चे के अंदर कोई इस किस्म के चैलेंजेस आप देखते हैं तो उसकी एक बेसिक क्लिनिकल असेसमेंट ज़रूर कराएं।
yeah,
आप मालूम करें कि उसका आईक्यू लेवल क्या है, कहीं ऐसा तो नहीं वो ऑटिज्म के साथ है, कहीं ऐसा तो नहीं वो इंटेलेक्चुअल डिसेबिलिटीज के साथ है, और वो एक स्कूल में बस खामखा बेचारा जो है वो फेल हो रहा है, और फेल हो रहा है, ना टीचर समझ पा रहा है, ना पेरेंट्स समझ पा रहे हैं कि वो किस लिमिटेशन के साथ है या किस चैलेंज के साथ है। तो ये इस प्लेटफॉर्म से प्लीज़ ये मेरा मैसेज पेरेंट्स के लिए, और मैं हर जगह जहां मैं पेरेंट्स के साथ बात करती हूँ वो इस चीज़ को ज़रूर चाहती हूँ कि उसकी अवेयरनेस होनी चाहिए, हर पेरेंट में होनी चाहिए इस चीज़ की अवेयरनेस। बहरहाल माहम जो मेरी अपनी बेटी स्पेशल नीड्स के साथ है और स्पेशल ओलंपिक्स की एक बहुत कामयाब एथलीट है, मेरी जर्नी भी उसके साथ इसी तरीके से शुरू हुई थी। मुझे भी नहीं पता था, वो उस वक्त 13 साल की थी, कि स्पेशल नीड्स बच्चा क्या होता है, स्पेशल स्कूल क्या होता है, और आगे मुझे इसके साथ अब कोप कैसे करना है, माहम को अपने चैलेंजेस के साथ किस तरह फाइट करनी है। बहरहाल जब कहते हैं अल्लाह ताला आपको एक उसमें डालते हैं, मैं इसको एक आजमाइश ही कहूंगी, लोग इसको सजा कहते हैं, लोग इसको जाने क्या क्या नाम देते हैं, लेकिन मैं समझती हूँ कि अल्लाह ताला ने मुझे इस बच्ची के जरिए एक मकसद से जोड़ दिया। ये कॉज था स्पेशल ओलंपिक्स पाकिस्तान का, जो न जाने सैकड़ों हजारों पेरेंट्स के लिए एक मोटिवेशन, एक मैसेज, एक होप बन गई माम की स्टोरी। तो अल्लाह ताला ने शायद हमें जोड़ना था इसी तरीके से। बहरहाल माहम की स्टोरी स्पेशल ओलंपिक्स पाकिस्तान में 2014-15 से, जब वो 15 ईयर्स की थी तब स्टार्ट होती है। लाइक उनका अपना स्कूल जो स्पेशल स्कूल था, वहां से माहम स्पेशल ओलंपिक्स पाकिस्तान में रजिस्टर्ड हुई, और फिर वहीं से उसकी जर्नी एज एन एथलीट स्टार्ट हुई। और माशाल्लाह
Yeah.
29 हमारी जो स्पेशल ओलंपिक्स वर्ल्ड समर गेम्स होती हैं उसमें माहम ने साइकिलिंग में गोल्ड मेडल हासिल किया। तो ये वो अचीवमेंट थी जो ना सिर्फ माहम के लिए भी, यानी अनबिलीवेबल थी, मेरी
Yeah.
अपनी ट्रांसफॉर्मेशन हुई, माहम की ट्रांसफॉर्मेशन हुई। वो बच्चा जो हमारी सोसाइटी जिसे पुश कर देती है ना कि ये कुछ नहीं कर सकता, तो उसको मजीद बैक बेंचर बना दिया जाता है कि ये नहीं कर सकता, उसका कोई साथ नहीं देता, वो बहुत ज्यादा पुलिंग और आइसोलेशन का शिकार हो जाता है। लेकिन 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 आप अपने बच्चे की उन स्किल्स पर काम करें, आप अपने बच्चे की उन टैलेंट्स पे काम करें जो जो उसके अंदर मौजूद है, जो हिडन टैलेंट। कभी कभार ये भी होता है, कोई बच्चा बहुत अच्छा सिंगर होता है, कोई स्पोर्ट्स बहुत अच्छी
Yeah.
कर सकता है, कोई बच्चा बहुत अच्छा आर्टिस्ट होता है, कोई बच्चा बहुत अच्छा स्पीकर होता है। ये वो हिडन टैलेंट्स होते हैं जो हम देखते ही नहीं हैं। हम हर बच्चे में सिर्फ डॉक्टर, इंजीनियर और बस ये वाली हमारी हमारी एक सोच है ना कि हमारा बच्चा या तो
Yeah.
डॉक्टर बन जाए, इंजीनियर बन जाए, या बिजनेस डिग्री कर ले। तो ये वो चीजें हैं जो मैं समझती हूँ हर पेरेंट्स को ये चीज मालूम होनी चाहिए कि अगर आपका बच्चा किसी भी लिमिटेशंस के साथ है तो उसको किसी घर के कोने में ना छोड़ दें, उसको ये सोच के कि बस अब इसकी जिंदगी खत्म हो गई। अगर मैं भी ऐसा ही करती तो आप यकीन करें उरूबा के आज माहम, शी इज 25 नाउ
जी.
माशाल्लाह, लेकिन वो स्पेशल ओलंपिक्स पाकिस्तान की एक कामयाब एथलीट है, न सिर्फ
Yeah.
इंटरनेशनल बल्कि नेशनल लेवल पे उसको दुनिया जानती है। मैं उसकी वजह से पहचानी जाती हूँ, आज मैं यहाँ उसकी वजह से बैठी हूँ। मुझे माहम की
जी.
मदर की हैसियत से लोग जानते हैं कि ये माम जहरा की मदर है। तो अब मेरा पैशन है कि मैं उन स्पेशल मदर्स को, उन स्पेशल पेरेंट्स को एक वो मैसेज माहम के थ्रू या अपनी स्टोरी के थ्रू हर जगह स्प्रेड करती हूँ, बताती हूँ कि देखिए मैं कर सकती हूँ, माहम कर सकती है, तो आपका बच्चा भी
जी.
कर सकता है, नहीं कर सकते हैं। चैलेंजेस सबके साथ हैं, मेरे साथ भी थे, लेकिन उन चैलेंजेस को ओवरकम करना, अल्लाह ताला ने इंसान को बड़ी ताकत दी है, बहुत हिम्मत
Yeah.
दी है। और
Yeah.
मैं हमेशा पेरेंट्स को ये कहती हूँ, आप कर सकते थे इसीलिए ये बच्चा आपके घर में है, आपके अंदर पोटेंशियल था, अल्लाह ताला ने आपको
Yes.
कुछ सोच के स्पेशल बच्चा दिया, वरना हर घर में एक स्पेशल बच्चा होता। आप
Yes.
कर सकते थे
Definitely.
इसीलिए ये बच्चा आपके घर में। तो ये एक जो इंस्पिरेशन या होप या एक मोटिवेशन जो होती है ना, वो हम स्पेशल नीड्स पेरेंट्स को वक्तन फवक्तन बहुत जरूरी होती है देना, और हर रोज हमें ऐसा लगता है शायद अब आगे और क्या होगा, ये हमारे साथ भी होता है, अब कल का दिन क्या होगा या आज का दिन क्या होगा। लेकिन जब हम अपनी अपने ही जैसे लोगों में, अपने ही जैसी फैमिलीज में बैठते हैं, तो हम एक दूसरे की जब मोटिवेशनल स्टोरीज सुनते हैं, थोड़ी बहुत एक आपस में बातचीत करते हैं, तो हमारी होप बढ़ती है, हमें मोटिवेशन मिलती है, हमें एक दूसरे से मौका, एक मदद मिलती है। हम अगर कहीं किसी जगह पर मैं समझ नहीं पा रही हूँ कि अगर मुझे माहम के साथ कोई चैलेंज नजर आ रहा है, तो मैं किसी से मशवरा कर सकती हूँ, वो मुझे बेहतर हेल्प और सपोर्ट कर सकते हैं।
Yeah.
और इसके साथ एक हमारी कम्युनिटी है, उस
Hmm.
कम्युनिटी के अंदर
Yeah.
हम ग्रो कर रहे होते हैं, वहाँ हमें कोई जजमेंटल, हमारी किसी की नजरें नहीं होती, जजमेंटल थॉट्स नहीं
या
होती।
आई थिंक
हम
कम्युनिटी एक ऐसी थ्रेड है जो हम कॉन्स्टेंटली इस बारे में बात करें कि सपोर्टिंग कम्युनिटी इज इमेंसली इम्पोर्टेंट, जिसकी जिसकी इम्पोर्टेंस को आप सही तरीके से स्टेट भी नहीं कर सकते, बिकॉज इट्स समथिंग दैट्स truly important. That was wonderful insights, Farah. Thank you so much. I think I would like to move forward with Nayab. I think now that we're closing up, if there's one thing, like for example, if there's one change that you could implement, like a policy or a practice or community attitude. So what would you say is like the one thing? Again, we can't change एक चीज से कुछ भी. It's a vast thing and it's a whole topic on its own. But if there's one thing that we can start with, what do you think is like the right point to start? If someone जिसको इस बारे में इतना पता नहीं है, and we're just, trying to make them understand the scope of this. So what do you think is the first step?
Okay. So I think there are a lot of things, but if I have to
Yeah,
be very specific, is to learn how to sit with that discomfort when
okay.
people talk about disability, right? Because there's like a lot of discomfort. Because the first reaction normally, like if I am like, oh, I'm disabled, people would be like, oh, but no, you look this, like all the positive things. And I'm like,
Yeah,
yeah, but it still doesn't change the fact that I am disabled, right? Because it causes a lot of
yeah,
discomfort. So if we talk about
yeah,
specifically to therapy room, then learn how to sit with that discomfort, right? Is it helping the other person, or is it just we need to learn how to sit with our own discomforts? Learning history, um using like a more affirmative framework, researching on disability, ableism, all these different things. And I think if we have done our work on like on the individual level, then only we can spread that awareness. Because अगर
yeah,
we are uncomfortable with the conversations around disability, then हमें awareness पहुंचाने में भी we would hesitate, right? We would take the back seat. Because
yeah,
so I think doing our own work, being open enough to unlearn things that we are already taught in psychology
yeah,
school, or as human beings. And it is okay to mess up, right? It is,
yeah,
because sometimes we are like, oh,
definitely.
I don't want to say the wrong thing. I don't want to cause a lot of harm. Like, you will make mistakes, and that is okay. What
Yeah,
matters is you learn, you unlearn, and then you relearn, and learn
hmm,
from the disabled people, their narratives, and kind
yeah,
of like center them. Um, yeah.
right. Yeah, definitely. That was a very fruitful discussion. I wish we had more time कि हम और ज़्यादा इस topic बात कर सकते हैं, discuss a lot more, because I understand कि it's a vast topic. There's a lot more to talk about and discuss. But since we're short on time, I think we would like to take some questions to her area. Would you like to, go through the chat, and if we
Yeah.
have any questions so that we can take
So,
those?
yeah, so we do have some questions. We have a question from
Yeah.
Fatma. How to handle sensitivity as an individual? Like everyone is differently sensitive in their own way, with or without special needs or disability. So, how do we handle sensitivity? Is primarily the question.
Yeah, I think anyone from the panel can go ahead if they feel like they can answer the question.
I think it's just literally about getting to know someone with a disability and just being open, like Nayab said, just being open, not having any sort of an agenda or any sort of a goal out there, मुझे बहुत अच्छा होना है या मुझे बहुत, careful होना है. Just be yourself, just be calm, and just see what comes your way, and just be kind. I think that's all I would say.
I
Yeah,
that
I
that
think that,
is
yeah.
yeah, that is important. And we have another question from Duresh Hevar. In what ways therapy can be adapted for individuals who are non-verbal or have intellectual disabilities? I think you've answered that, but if Nayab, if you can take that and sort of, briefly go over it.
Okay. So I don't usually work with children specifically. I do work with older adults. With being non-verbal, you can always ask them, "Oh, can you write things down? Like meet where they are." Right? And just always ask them, "Okay, what works for you, what doesn't work for you," and like be ready to adapt to it. Um, yeah, so you always ask for their accessibility needs where they're at. So because हमें साइकोलॉजी में पढ़ाया जाता है कि it works for very specific kind of people. So there is a lack of a framework. There's a lack of research. There's a relatively new therapy that is called neurodivergent affirmative therapy that moves away from like the disability, like disability paradigm just जहाँ पे we are like, ooh, it's like वो pathologization जहाँ पे आ जाती है कि ooh, wrong, disorder, right? So it's like more, it moves towards more, something more affirmative. I do have a book recommendation, but it is also very specific to autism. It's called Unmasking Autism by Devon Price. So learn, like, research more on an affirmative framework. There's very limited research, so you'll have to like struggle to get the research and like resources.
Yeah, yeah,
Uh, but yeah.
yeah. Okay, yeah.
I think
We have,
also, has her hand up, so
yeah,
if she can go next, and then Dr. Asif will take your comment.
yeah. Dr. Asif had a question.
Hello, Assalamu alaikum.
Walaikum assalam. Dr. Asif, I think आपकी
Thank you
connection
so
थोड़ा सा
much
जो है,
for
it's
giving me
difficult
the opportunity for this.
to hear
I did
you.
have an opportunity just for 35 years as a clinical psychologist. Can you hear me better? Is it better now?
Yeah, yeah, it's
Okay.
better.
So I would like to say that I did start my career at hospital at Child Guidance Clinic. And what Dr. Shaista was saying about denial, yes, there's definitely a huge, denial from the parents. So I remember that I tend to ask them, do you want to raise the child you want or the child you have? And that would be very difficult for parents to understand, because that's when the reality would hit them, and they would realize, because of course every parent want their children to be normal, and so that is something that we have to draw the line, and so they give them a reality check. It's very difficult, it's very tough, and it's very heartbreaking, but it's still necessity for them to do the right thing. And raise the child with this disability. And another thing that someone was talking about, accessibility. It's again a sad thing that we are when we talk about people with limited abilities or some compromised developmental issues, uh, these people are marginalized practically, and they're invisible. The reason why I'm saying that, and again, a sad reality, is that this whole thing has to be incorporated into the infrastructure of the society. Like, I'm just talking about simple things like sidewalks should have, at the edge, they should have like slope, so the wheelchair or the stroller can be rolled smoothly and all that. And not only hospitals, other buildings should also have ramps, instead of in addition to staircases and everything. But again, it's
Yeah,
part of the government and all that, so that's it's not a criticism, it's just the awareness and acceptance of a sad reality. One thing I realized, that one of the most prominent medical institution in the country, in US, is Northwestern Medical University and Medical Center in Chicago. They used to have they're big on brain injury and rehab and everything. They changed the name of their rehabilitation center to Ability, Shirley Ryan Ability Lab, because they said that just the name disability itself stigmatizes the disability itself. So they changed it to Ability Lab, because that's where they build upon strengths that people have who come to be their clients, instead of focusing upon their disability. I just wanted to share these important,
yeah. Yes, great
aspects of.
insights, Dr. Asif.
Thank you so much.
Yeah,
Appreciate that.
of course. I think, Afshin, you had your hand up. If you have a question, you can ask, or you can leave it in the chat, and then we can see it. वहाँ पे
There's one more question.
I have a one very. Assalamu alaikum, I'm Afshin. I have a one short question,
yeah,
especially from Nayab.
yes, go ahead.
Uh, These days, the mental disorders, cause of having a lot of information on social medias and other platforms, we do have awareness, but there is lack of right awareness, and especially after the cases of different celebrities announcing themselves as having any mental issue, especially the one about Alia Bhatt. He had been disclosing it that I am having ADHD. Most of the people are taking it as a victim card. So what will be your thought in this thing? I am figuring it out, like most of the people are misdiagnosing their mental disorders, and this thing is causing hindrance for the people who are actually suffering because of these
Yeah,
mental disorders. So what will the thought of panelists on this.
Yeah, I think that is
Yeah.
a good point. Misdiagnosis or self-diagnosis specifically without, proper
Oh, yeah.
clinical person on hand. Can I go ahead?
Yeah, I have so much to say on this because this is something that I've seen very frequently where I work as well. Um, I personally believe that self-diagnosis is extremely valid, especially when it comes to autism and ADHD. The reason being, all of the research that is done on autism and ADHD is not representative to people of color or women, for example, or gender non-binary people, because uski presentation is very different. Right, so with Instagram, with access to internet, a lot of people are getting more aware कि, oh, this is maybe something that we are struggling with, and that is completely valid, because if you go to a therapist or a psychiatrist, and because again that is also coming from a place of personal experience, because I was diagnosed with borderline personality disorder, and they put me on antipsychotics that really messed me up, because I was like, oh, I'm not BPD. There's also a lot of stigma attached to BPD. That is an entirely different conversation. Um, but the reason why I've reached to this conclusion, and then it also gave me proper resources, catch out who can I reach out to, because I did my own research. A lot of times, psychology, like therapists even, they would dismiss के okay, ठीक है, आपको autism ADHD नहीं है, they do not believe in self diagnosis. But if we talk about in a bigger picture कि how mental health community generally works in Pakistan specifically, given कि resources नहीं है, adult autism और ADHD का diagnosis आपको नहीं मिलता unless you seek like somebody who is like extremely specialized. They're super expensive, and not everybody has access to that, right? So a self-diagnosis sometimes enables you to find your community. Coming to the next part of the question, a lot of people use their diagnosis as a victim card. There are bad people everywhere. A lot of abusive people would also be like, oh, नहीं मेरे बचपन में बहुत सारे traumas थे, that is why we are doing this, right? So you have to use your discernment over there. Okay, never assume that you know better than the person who has a certain kind of experience, because they might be right? Because and again, doing our own research and understanding all these concepts is extremely important, because misdiagnosis mental health community में वैसे भी होता है. It's not specific to autism and ADHD or disability. Every kind of disorder, there are a lot of people, there's a lot of malpractice, unfortunately, in Pakistan as well. Lots of wrong medication, lots of misdiagnosis, lots of re-traumatization by the therapist. And it sometimes pisses me off as well, because I'm like, oh, we have to undo all the harm before we start therapy. Like, please, hello. So yeah, learn more about that. Or to me personally, according to like my own journey, if I had not believed a self-diagnosis, and if I hadn't find a community who validated my experiences, I would never have been diagnosed. Because as a disabled person, I would always question myself, oh, am I really that autistic? Like, am I, or am I just like pretending to be autistic, So there's a lots of self-gaslighting and lots of shame that is already attached to it. So if they came in the therapy session and you're trying to reinforce the same idea कि नहीं आपको नहीं पता और मुझे पता है, then it is also causing them a lot of harm, because there's also a lot of shame that they're carrying, right? So being a little sensitive about that, and never like outright like dismiss. Okay, and there are
Yeah,
some people who are like अच्छा हमें ये disorder है, but when you like explore that तो उस तरह से नहीं होता. So you do
yeah,
not have to be like नहीं आपको नहीं है. You can just like explore like the symptoms a little bit, and like be a little more um gentle about it, because misdiagnosis बहुत common है. आपको diagnosis नहीं मिलता. You have to struggle a lot. So specifically when it comes to ADHD, autism, complex PTSD, I strongly do believe that a self-diagnosis is extremely valid. So I hope that answers the question.
yeah. I think a lot of people in the comments can relate to that as well. Yes, Farah, you're saying something.
जी बिल्कुल, जहाँ महंगी थेरेपीज की बात हो रही है तो यहाँ मैं एक चीज़ ऐड करना चाहूँगी कि स्पेशल ओलंपिक्स पाकिस्तान जो स्पोर्ट्स एक्टिविटीज़ कराता है वो फ्री ऑफ कॉस्ट है, और स्पोर्ट्स से बेहतर थेरेपी इन बच्चों के लिए कुछ नहीं हो सकती। वो इनका सेल्फ कॉन्फिडेंस बढ़ाती है, इनकी सेल्फ वर्थ बताती है, और इनको सोशल कनेक्शंस बनते हैं इन बच्चों के, स्ट्रेस कम होता है, लाइफ स्किल्स डेवलप होती हैं। ये वो तमाम चीज़ें हैं जो स्पोर्ट्स के जरिए ये बच्चे सीखते हैं, और स्पेशल ओलंपिक्स पाकिस्तान फ्री ऑफ कॉस्ट ये तमाम ट्रेनिंग्स करा रहा होता है। तो ये बात भी पेरेंट्स तक पहुंचना बहुत जरूरी
Yeah.
है। बच्चों में इंडिपेंडेंस आती है, एक जो लाइफ स्किल्स होती हैं बच्चों की वो डेवलप हो रही होती हैं। हमारा एक टीम स्पोर्ट्स होता है जो कि यूसीएस प्रोग्राम के अंडर आता है, जिसमें मेन स्ट्रीम बच्चे हमारे एथलीट्स के साथ टीम अप करते हैं और खेलते हैं। उन सबका एक ही गोल होता है कि सामने वाली टीम को हराना है, और टीम वर्क कैसे करना है।
Yeah.
तो वहाँ
Yeah.
इनकी कम्युनिकेशन बेहतर होती है, ये प्रॉब्लम सॉल्विंग चीजें सीख रहे होते हैं, और बहुत सारी ऐसी एक्टिविटीज में हिस्सा ले रहे होते हैं जिससे इनके अंदर अपने अपने लिए बोलने की जो सलाहियत है वो इंक्रीज हो रही होती है, इनके अंदर एक अचीवमेंट का एहसास पैदा होता है। तो ये वो तमाम चीजें हैं जो स्पोर्ट्स के थ्रू एक बच्चे की प्रॉपर एक पर्सनैलिटी ट्रांसफॉर्म हो रही होती है। तो ये तमाम फायदे जो होते हैं ओवरऑल ऑफ कोर्स इनकी मेंटल वेलबींग पर बहुत
Yeah.
ज्यादा काम करते हैं, वो एम्पावर होते हैं। बस ये एक छोटा सा
Yeah,
पॉइंट था जो
definitely. Yeah,
चाहती
I'm glad you added that. I think we are over time now, and I think
Yeah,
it's
very
time to wrap
fast.
this up. It was a fruitful discussion. I'm sure everyone learned a lot, and we got a lot of messages to take home with us, and a lot of things to consider and be mindful of. I will share a email with everyone who registered with all of the resources of all of the panelists. Case how can you reach them through LinkedIn or whatever they're comfortable with. I'll share that with you guys as well. I'll also share a link to it's a research. They're collecting some data. It's related to the topic. So I'll share the link of that as well. So hopefully you guys, can take some time out and fill that form out as well. It was wonderful to have everyone on board. Thank you so much to the panelists, and thank you to everyone who attended this. It was a great discussion. Aria, would you like to
थैंक
add something?
यू, थैंक यू
Of course.
रूबा, नाया।
No, I think we're way past time. I just wanted to thank everyone who joined in and to the panelists again for being here. It was wonderful. We will continue to keep doing this. Yeah. Thank you.
Yeah. Yeah, it was the first of many. So hopefully we'll see most of you guys again soon. Thank you.
Thank
All
you.
right. Bye, everyone. Take
थैंक
care.
यू,
Bye.
Thank you
अल्लाह
everyone for joining. It was lovely. Take care.
Thank you.
Bye.